Mr. Paul.
Dr. Orford, the UK Coronavirus Action Plan was published on the 3rd of March 2020. In your witness statement, you say, prior to its publication, I had commented by email of the 1st of March that the document was Anglo-centric and needed to be better reflect the devolved nature of health and the responsible organisations in Wales. First of all, I suppose, did the final version take on board your comments?
But that's a good question. I can't recollect reading the last version, but I recollect seeing comments from other colleagues, a summary of comments back from devolved governments making the same comment that it needed to reflect the UK rather than the position in England.
And why do you feel the action plan was Anglo-centric?
I mean, quite often if you see documents that have been drafted fairly swiftly, I think that email probably came on a Sunday night to about 200 people. Often you'll find references to the NHS. Well, there's 4 NHS organisations within the UK. So unless you're looking through a telescope from a devolved government perspective, it's not easy to capture all of those nuances of the difference in devolved governance.
On the 12th of March, Wales, like the rest of the UK, moved from contain to delay, and then on the 17th of March, the First Minister advised that the public should limit non-essential contact, work from home where possible, and avoid social venues. In your view, did that advice go far enough on the 17th of March?
I think probably from the 17th of, well, before the 17th of March, it was looking pretty precarious, and actually we probably should have gone further then.
We have a look, please, on the 20th of March. It's a TAC COVID-19 briefing document, 000-83241. Thank you. If we can have a look at page 1, first paragraph. TAC advised that the risk of exceeding NHS capacity was higher than previously considered. And then paragraph 2, please. TAC recommended that further control measures, e.g. a lockdown, should be urgently considered as a further potential control measure to reduce population mixing and decrease the risk of exponential growth in demand. Picking up on your answer to the previous question and now having a look at this document, given the worsening clinical picture, do you think the advice should have gone further than recommending further control measures simply being considered? Should the advice have actually recommended the introduction of further control measures at this stage?
That's a good question. Hypothetically, should we have urged a lockdown sooner? I think that's what we were saying here, that you needed to go sooner. And just to try and fit this into context of what was happening, I believe there was a SAGE meeting on the 16th of March where there was a discussion that the doubling time was shorter than previously thought. And perhaps there were more cases in the community than possibly being picked up through the ICU sentinel surveillance. So the picture was pretty bleak at this time that we were somewhere down the track.
If we could please have a look at an email that you sent to Dr. Atherton on the 22nd of March. It's INQ 000350513. This is an email in response to an email he had sent with information from Sir Chris Whitty on the UK government strategy. And you say at page 1, first or second substantive paragraph, I'm not sure I agree with the end game insofar as others see a more refined approach to the end of the affair that is not captured in the current SAGE peak model of imperial maximum short-term suppression coupled with an aggressive but refined testing, isolation and release strategy. And this needs to be done as soon as possible, e.g. tomorrow, brackets 2 to 3. Why did you disagree with the UK position on the second wave, the bounce back, as some have called it?
I'm not sure I'm disagreeing at that point. I haven't got the document from Chris Whitty to refer to, but I think at that point I'm highlighting the need for more testing, more contact tracing, as well as the suppression methodology.
As we know, the UK, including Wales, entered lockdown on the 23rd of March. Do you consider the lockdown in Wales was imposed early enough?
At the time, the discussion was that we were possibly a couple of weeks behind London, and that London was further advanced than us because of the nature of the seeding of the infection into the UK. In hindsight, the scientific papers suggest a week earlier would have been better. So if the UK had gone into lockdown on the 15th, then that would have been better than the date it did go into lockdown in hindsight.
I think you refer in your witness statement to a modelling study that showed that introducing measures 1 week earlier would have reduced by 745% the number of COVID cases in England by the 1st of June. Is that right?
That's correct, yeah. It's not my work, but that is the finding of the paper.
And that would have resulted in approximately 21,000 fewer hospital deaths and 34,000 fewer total deaths. And also the total time spent in lockdown would have been halved from 69 days to 35 days.
According to the model, yes.
But what happens if you do then get another high wave?
I think we did get another high wave.
Exactly.
Yes.
So how does one look at those figures? If you've had those figures for the length of the lockdown, and then you get another high wave, the number of deaths overall, can one say whether there was any impact on those?
Depends when you intervene on that second wave, I guess.
So timing of further restrictions in, say, autumn, winter 2020 would have been critical.
Yes.
Before we leave March, can I just ask some questions about the advice you provided to the Welsh Government as regards transmission risks of allowing mass gatherings to go ahead? If we could have a look, please, at INQ 000271446. At page 13, I'm grateful. So this is an email that was sent on the 9th of March from the Principal Private Secretary to the First Minister. The email asks for advice in relation to cancelling major events due to coronavirus. Excuse me. Your reply is at the top of page 11, I think, and it's dated the 11th of March. So you send a technical briefing on mass gatherings. We can see that briefing. Perhaps if we can bring up that briefing, it's INQ 000271447. Bottom of page 3 of this briefing, in answer to the question, should I continue to attend or run sports events, the briefing advises that there is presently no scientific evidence to support the closure or cancellation of sporting events, but this may change as the situation evolves. And then over the page 4, first paragraph, in answer to the question why the Six Nations rugby is going ahead this weekend, the briefing states, the 4 CMO's position on the science, not sporting restrictions on mass gatherings at this point in time, is very clear and has been reinforced by the Health and Social Services Minister re the rugby. It's the prerogative of individual sporting bodies to make their own decisions. Is it right that the advice that you were giving and that TAC was giving at this time was based on the view that the events themselves would not be major vectors for transmission?
Yeah, that's correct. The advice that I was giving, and I'm not certain that this document is one that I drafted. I think it was probably drafted by comms colleagues with some advice from myself within it. And the advice that I gave was the advice of SAGE and the calculations from the modelers regarding the impact, the potential impact of those events.
I mean, the events foreseeably entailed people travelling for the match. So we've heard that 20,000 Scottish rugby fans travelled to Cardiff in advance of the rugby match. And they foreseeably would have entailed people meeting in pubs and bars ahead of the match. I mean, from a public health perspective, would it not have been prudent to advise against mass gatherings going ahead?
I think in the benefit of hindsight, it would have made sense. Just the optics of this to stop the events going ahead. But from an epidemiological perspective, then perhaps closing all bars at the same time to stop displacement activities. So whilst the risk of these individual events negligible compared to the whole population where transmission happens all of the time everywhere, actually what they presented to the public was these events are okay.
Are you aware that the advice from Public Health Wales was that the match should be postponed or cancelled?
I don't think I was aware at the time that that was their advice, but that is their responsibility to provide public health advice.
The evidence that Sir Chris Whitty has given to the inquiry on the 21st of November, he spoke about the consequences of allowing mass gatherings to go ahead. If we can just please see a passage of the transcript of his evidence. I'm grateful. It's so internal, page 189, lines 13 to 19. So Sir Chris Whitty said, they're allowing mass gatherings and sporting events to go ahead, signal to the general public that the government couldn't be that worried. And he stated, so I think that the problem was not gatherings themselves, which I don't think there's good evidence has had a major material effect directly, but the impression it gives of normality at a time that what you're trying to signal is anything but normality. And Professor Whitty also stated that debating the closure of schools whilst allowing sporting events to continue and mass gatherings to remain open was, his words, logically incoherent to the general public quite reasonably. I mean, do you agree with Sir Chris Whitty's views as expressed there?
Yes, I do.
We can change topic, Dr. Orford, and talk about testing. Now, from the 22nd of March 2020, you were the senior responsible officer for testing, is that right?
That's correct, yeah.
If we could please have on display 000309871, which is an email of the 22nd of March, Quentin Sandifer of Public Health Wales, emailing you and Tracy Cooper regarding testing. In this email, Dr. Sandifer expresses concern about Wales losing out in relation to testing kits. Dr. Sandifer says, above all else, I'm really worried that national politics could trump public safety and need in Wales, and we end up losing out badly in Wales. What do you understand to be Dr. Sandifer's concern about national politics trumping public safety?
Man, that's a really good question for Dr. Sandifer. My understanding that the whole of the world were looking for tests for COVID, including UK government and including Welsh government. Including Public Health Wales, and Public Health Wales were concerned that an agreement had been struck with a company that wasn't honoured because of other power plays going on at UK level.
I mean, did you have concerns at this point in time, as this is 22nd of March, about whether Wales would be able to rely on UK-wide initiatives to scale up testing capacity in Wales?
So I was unaware at that time that if there was or wasn't a UK testing plan. And so on the 23rd of March, the next day, or on the 22nd, I asked who was responsible for coordinating testing in Wales. It turned out that to be me. I was given that privilege. And by the 23rd, we'd assembled a group, including Public Health Wales, to draft a high-level testing plan to scale up testing, partly because of this problem.
On the 27th of March, you were asked questions about the testing strategy on behalf of Mr. Gethin. The email that I'd like to display is INQ 000383998. Thank you. So on the second page, we can see there, the Minister, Mr. Gethin, has a number of questions he would like answered before the testing plan can be published. And the email refers to concerns regarding testing capacity and concerns about being reliant on UK initiatives. Now, your reply is the text that we can see in red in this email. Middle of that page, the email specifically references being let down by Roche. And that is what you've just alluded to a moment ago. If I can perhaps give a summary of the situation, and you can tell me whether I've got it right. There was an announcement made by Mr. Gethin on the 21st of March that the Welsh Government would have access to 6,000 COVID tests a day by the 1st of April. That appears to have been based on an agreement that the Welsh Government believed it had, or at least was negotiating with the Swiss pharmaceutical company Roche. However, Roche ended up supplying tests to the UK government for use in England, and then after agreement with the devolved administrations. Is that more or less an accurate summary?
I think that agreement would have been with Public Health Wales and Roche rather than Welsh Government, was my understanding. And I don't think that was a written agreement. I think it was a verbal agreement.
If we have a look, please, page 2, paragraph 4 of, let me just check. If we can have actually, please, INQ 000309905 displayed. This is an email from Tracy Cooper to you and others. Yes, I'm grateful, thank you. So page 2 and paragraph 4 of this email, it is said there, I'm reading from the little a, it is clear that the situation is rather chaotic and the agreements that have been made are not being honoured, and with the political environment we cannot be assured that other commitments will be met. Would it be fair to say that there was little trust that UK-wide testing initiatives could be relied upon at this stage?
I think there was a great deal of uncertainty at that stage.
I think it's right to say for those who haven't followed this that this incident involving Roche and the number of tests, it has been highly controversial as to whose memory is accurate.
Yeah,
Would that be
absolutely.
fair?
But I think Tracy's emails are very, are accurate at the time. They were captured with the knowledge at the time.
Was there a concern that you would be competing with the UK government in the supply of testing materials?
Yes.
Now, we know that a testing plan was published in Wales on the 7th of April 2020. The inquiry understands that the Welsh Government published the document Test, Trace, Protect, setting out its strategy in relation to health surveillance in the community on the 13th of May. So that strategy is published 4 months after the global emergency was evident. Why did it take 4 months for that testing strategy to be developed?
So the first test plan wasn't published, but it was finalised and agreed by the then Minister for Health and Social Services on the 27th of March. So 4 days later, then we brought the group together, and the principal objectives there had 6 work packages, with the first one being to scale tests. That plan was then shared with devolved governments and UK government.
Dr. Orford, change of topic. I'd like to ask you some questions about discharging patients from hospital to care homes next, and also the related question of testing as well. On the 13th of March 2020, the Minister for Health and Social Care made a public statement announcing a framework of actions aimed at allowing health and social care providers to make decisions to assist with the timely preparation for the expected number of confirmed cases, and we can see that on the screen there. At point 4 of that announcement, we can see it said expedite discharge of vulnerable patients from acute and community hospitals. And then at point 7, suspending the current protocol which gives the right of a choice of home. Is it right to understand the purpose of these measures was to ensure timely discharges and basically try and eliminate delays related to care home choice so as to maximise the number of hospital beds that were available in the event of a surge in hospital demand?
That would make absolute sense. I had no involvement in writing these policies, so that those questions might be best addressed to those involved in the policy decisions here.
Do you agree, though, that expediting the discharge of vulnerable patients from hospital into care homes presents a clear risk that obviously had to be managed?
Oh, I think there were significant risks around hospitals and care homes throughout the pandemic.
If we could please have INQ 000336353 on screen, which is an email exchange on the 31st of March between the Deputy CMO, Dr. Jones, and various HSSG officials. If we can please go to page 3. We're there already, thank you. Dr. Jones replies right at the top of the page, I would think that no place for testing prior to discharge, as negative one day can be positive the next. Did you or TAC advise on this?
No.
On the 9th of April 2020, Public Health Wales issued guidance on the admission and care of care home residents. The advice was that negative tests were not required prior to transfer and admission into a residential setting. Again, did you or TAC advise on that?
No.
On the 17th of April 2020, there was a meeting of the Closed Settings Group, which was a Public Health Wales group, as I understand it, albeit I think I'm right in saying it had some overlap with TAG and TAC membership. Is that right?
It's possible that members of that group, I'm not sure who was on the group, so it's difficult for me to answer, but we're a relatively small organisation, so there may have been some overlap.
If we could please have INQ 000336421. Thank you. This is an email sent following the meeting of that closed settings group on the 17th of April. Page 2 of the email chain at action 3 reads, Welsh Government policy officials verbally outlined a clear request policy instruction from CMO, Director of Social Services and Integration, for the testing of non-COVID-19 patients prior to discharge from hospital to care home setting. This would be consistent with the approach being taken in England. See letter and action plan attached. Welsh Government to confirm the policy decision on communication, lead Welsh Government policy officials. Did you agree with the change of policy regarding the testing of patients discharged from hospitals to care homes?
Again, I wasn't involved in these policy discussions. I'm not sure I was included. What was the date, sorry?
The date of this is the 17th of April.
No, I was no longer involved in testing at that point.
Please, can we have INQ 000228309 displayed, please? This is an email thread from the 31st of March and the 1st of April between you, Dr. Thomas Connor, Chris Williams, Public Health Wales, and other members of TAC. If we can go to page 6, we can see that the conversation begins with you explaining that the issue of nosocomial transmission has come up at SAGE and that it had come up in relation to Wales due to the Aneurin Bevan outbreak. If we can please go up to page 3 of this email chain. There's an email from Dr. Connor. He writes, I think it's the 4th paragraph, second line in. Thank you. So second line, in this case, we have a cluster of 50 to 70 cases who all flagged positive within around 7 days of the suspected index case. That to me suggests that how one implemented something like weekly testing would be critical in catching something like this early. I should think that if a portion of staff tested every day, then detection that there is a problem on a ward might be possible. But say testing everyone once a week could conceivably have missed basically all of the transmission here. So to me, the message is to design routine testing well, taking into account the observed timescales in AB, and understanding that such testing has to be rapid to be useful. So Dr. Connor's there saying that weekly testing might have missed all of the transmission of a particular outbreak, isn't he?
Yeah.
And then if we can go right up to the top of the chain, page 1, you state, as Tom suggests, first paragraph, as Tom suggests, a sequential approach to testing healthcare workers such that essential frontline staff are staggered across the week might be more sensitive to pick up outbreaks. We can ask HEIW for numbers of staff in the current policy if that sounds like a sensible approach. I just want to take you on the same theme just to a document that you emailed 2 hours later, Chris Williams emailed you this document 2 hours later. It's the CDC Centers for Disease Control Prevention study. I'm grateful we've got it on screen there. That study looked at asymptomatic and pre-symptomatic COVID-19 infections in residents of a long-term care nursing facility. If we could have a look, please, at page 2 of that study, looking at the top left-hand box. What is already known? Once COVID is introduced in a long-term care nursing facility, rapid transmission can occur. What is added by this report? 76 of 82 residents were tested. Approximately half of those with a positive test were asymptomatic or pre-symptomatic on the day of testing. And then what are the implications for public health practice? Symptom-based screening of residents might fall to identify all SARS-CoV-2 infections. Asymptomatic and pre-symptomatic residents might contribute to SARS-CoV-2 transmission. Now, this is the report that Mr. Hancock, in his evidence to Module 2, described as a game changer in terms of the scientific evidence underpinning testing policy advice in the UK. This was emailed to you. Did you view this study in the same way as Mr. Hancock, namely a game changer as regards asymptomatic transmission and the need to introduce routine testing, especially in environments such as care homes?
So, I tend not to have game-changing papers in science. It tends to be the accumulation of pieces of evidence to then form a consensus, and then you can say whether you're confident in that consensus or not. Just on the practicalities, if I can go back ever so slightly, I think probably around that time, there were in the region of 1,000 tests a day available in Wales within hospitals generally. There are 105,000 staff in the NHS in Wales. 36,000 of those are nurses and 9,000 of those are doctors and dentists, and 15,000 are allied health professionals and healthcare scientists who I'm responsible for. There are 10,000 beds within the NHS. There are 80,000 social care workers and 23,000 residential beds. So that's excluding other key workers. So there would be a huge demand for tests to test everyone. So the conversation with Chris Williams and colleagues was more about how you can create a web that acted as a kind of surveillance system where you didn't have to test everybody once a week. So you could pick up where outbreaks were and manage them effectively. So I think Chris's sharing of this paper was more about how you establish that sentinel surveillance system within staff groups rather than asymptomatic or pre-symptomatic testing per se. But there were plenty of papers that came through nerve tag around asymptomatic and pre-symptomatic people and testing.
Now, on the 16th of April, England introduced mandatory testing of all patients prior to discharge to a care home. And as we know, that policy was not introduced in Wales until a couple of weeks later. I just want to show you, if I can, the ministerial advice that was submitted to Mr Gethin on the 30th of April. If we could have a look at page 2 of the ministerial advice, it's the 5th paragraph and the 2nd bullet point right down at the bottom. We also intend to increase testing within care homes as more testing capacity becomes available. And then page 4, please, paragraph 16. Impact of asymptomatic care home residents. Whilst it is unclear what role asymptomatic positive individuals play in the transmission of COVID-19 is unknown, some may never develop symptoms. For those that develop symptoms, generally accepted that individuals may be infectious. There is some evidence to suggest that they are asymptomatic residents who are undetected and be a source of infection. A pilot study recently undertaken by Public Health England in 6 care homes in London that reported an outbreak tested all residents and staff groups. This study suggested that symptom-based screening in long-term care facilities could fail to identify approximately half of residents with COVID-19. Were you aware that that study had been discussed in the Public Health England meeting on the 20th of April and later a nerve tag meeting on the 24th of April?
Yeah, I think that was the Easter 6, that was called the Easter 6 care home outbreak analysis that was brought from nerve tag to SAGE a couple of days later.
And the preliminary results were that 75% of residents were positive for COVID, but only 25% were symptomatic, and 50% of staff were positive, but only 29% of those were symptomatic. You were aware of those preliminary results?
Yeah, and again, the conversation around whether somebody could be asymptomatic and transmit hadn't quite been landed. I think probably WHO advice was still the same around symptomatic individuals, and the case definition was still around people with the cardinal symptoms of COVID-19.
If we can, back to this ministerial advice, if I can please ask for page 5, para 19 to be pulled up. Thank you. Current position in care homes was to isolate symptomatic patients and test them if positive. The entire care home could be treated as an outbreak and it would be assumed that everyone was positive for COVID. And then the ministerial advice expresses concerns about the number of tests that would be required to test care home residents and staff on a routine basis, which is, I think, something you've also just alluded to. Is it right policy decisions on testing are obviously constrained by capacity? Is it your view that had capacity been increased, there would have been a sound evidential basis for regular testing of asymptomatic care home staff and residents? In other words, would the policy have been adopted sooner if capacity was greater?
So hypothetically, would we start at the position we ended at? I mean, logically, I would say yes. However, there was much more testing in the UK than there were in other countries. So, I mean, the logistics at the time, not just the scale of the need, was actually to bring testing to care homes themselves, where we couldn't reasonably expect care home residents to go to testing, as well as knowing who lived in care homes and who worked in care homes. There was quite a demand, a logistical demand and a digital demand on colleagues to operationalise the policies that came thick and fast. So it was a real challenge for colleagues.
Dr. Orford, was the change in policy on care home testing driven by what was happening in England rather than the scientific advice provided in Wales, in your view?
That's a very good question, and I think probably best aimed at colleagues who were leading on testing at this time, which, again, was a significant operational challenge with many people needing to work together at a national level to get things right. And again, comparing England and Wales is difficult because there's greater capacity and capability in England as it's 20 times bigger. But I honestly don't know the details around any differences in that policy and the timings of the policies therein.
We move into August. That saw the start of the Eat Out to Help Out scheme, and we know that's a scheme implemented by the UK government. Were you asked to advise on that initiative?
No.
I want to ask you some questions next about Firebreak. Before I would just like to ask you a question about data, if I may. On the 18th September 2020, the ONS released data that demonstrated that 68% of deaths from Covid-19 between the 2nd of March and the 14th of July 2020 were among disabled people. Following the release of those statistics, was any research carried out in Wales as to why that mortality figure was so high?
We wrote several papers on mortality statistics, working closely with colleagues in knowledge and analytical services, as well as papers on health inequalities of the absolute and relative impact on different population groups.
On the 18th September, TAC advised that more needed to be done to bring the R rate back down below 1. We can see the summary advice of the 18th September on the screen. If we have a look at page 2, the 4th bullet point, please. It says, a package of non-pharmaceutical interventions, MPIs, on local and national scale may be needed to bring R below 1. Some MPIs may need to be in place for a significant length of time, though an earlier and more comprehensive response is likely to reduce the length of time for which they are required. So TAC there advising action would be most effective if implemented early, correct?
Mm-hmm. Correct.
Circuit breaker or fire break, so in other words, as we all know, a short period of lockdown, that was recommended by SAGE on the 21st of September. I don't think you attended, but Fliss Bene attended on behalf of TAC. We can see those minutes there. If we can have a look at page 2.2, please. SAGE advice was that a package of interventions would need to be adopted to reverse the exponential rise in cases. Single interventions by themselves unlikely to bring the R below 1. And at the top of the list, as we can see there, the top bullet point, circuit breaker or short period of lockdown to return to instant levels to low levels. And if we can have a look, please, at point 6 on that page. The more rapidly interventions are put in place, the more stringent they are, the faster the reduction in incidence and prevalence, and the greater the reduction in COVID-related deaths. High confidence. Both local and national measures are needed. Measures should not be applied in too specific a geographical area. Presumably, as Fliss Bene attended on behalf of TAC, you were made aware of that SAGE advice.
Absolutely. I may well have been at SAGE that meeting, but it's not recorded. 4
days later, so this is the 25th of September, the need for early intervention was reiterated by TAC. I don't need to go to the advice. I'll just read summary. If the current measures do not bring R below 1, then further restrictions will be needed to control the epidemic in Wales. The earlier additional measures are introduced, the more effective they will be. And then on the 2nd of October, there was a rather more stark warning from TAC. We see the advice there. If we can have a look at page 2, please, 5th bullet point. Unless measures bring R below 1, it is possible that infection incidence and hospital admissions may exceed scenario planning levels. So in other words, the NHS would become overwhelmed.
Correct.
Yeah. Are you aware at this stage of any planning undertaken for further restrictions to be implemented?
I mean, I can't remember the interactions with the COVID policy colleagues at that time regarding, I can't remember the conversations going on that time.
If we have a look at the 9th of October, please, this is another TAC summary advice. We can see it INQ 000666397. Thank you very much. If we have a look at page 2, current situation in Wales, in the middle of the page. For the first time in this wave of infections, the incidence for Wales is higher than 100 cases per 100,000 people, and the total test positivity of Wales is 7.8%. All local authorities have seen more than 25 cases per 100,000 over the past week and have above 2.5% test positivity. We are continuing to monitor how the upward trajectory in cases, hospital admissions and deaths might evolve in the coming weeks. If exponential growth were to continue for more than 6 weeks, this could result in scenarios that exceed our reasonable worst case and planning scenarios. Notwithstanding the clear direction from SAGE that we saw in the minutes a bit earlier, the obviously deteriorating picture, why at this stage wasn't TAC clearly recommending the need for a firebreak?
So can I go back to the last question, please? Is that okay?
Of course.
At the time, there were local interventions, so understandably there were challenges around national interventions and concerns, and there was a great deal of interest around hyperlocal interventions and local interventions to reduce harm, reduce economic harm, and not to put areas that had lower incidence into protective measures at that time. So, I can't remember which local authorities were in what state during that period, but there was a lot of policy activity around intervening and monitoring and measuring, but still the epidemic was growing in Wales.
And reference to local interventions, we know that in sort of late September, early October, there were effectively local lockdowns within Wales, within some of the councils there.
Yeah.
Is that what you're referring to by local interventions?
And there was work done that was led by Llysbenni in Wales, looking at the impact of those local interventions to see whether or not they were having the desired effect. So, to be able to change policy, realistically, you need to bring evidence to show whether or not things are working.
The First Minister, in his written evidence to this module, has described those local interventions as his words were a failed experiment. Do you agree with that?
I'm not sure where the origin of the idea around local interventions came from, whether that was a UK government or Welsh government, but certainly I felt it made things more complicated, that you had to have more legislation, more policies in place across different local authorities. So I think in hindsight, perhaps they weren't the best idea.
Now, whilst I appreciate there may have been different policy initiatives being pursued, so we have local lockdowns at this time going on, but looking at what we've looked at, so the SAGE minutes, the TAC advice that's getting more and more stark, culminating in this advice of the 9th of October. So going back to my question, why wasn't TAC recommending clearly at this stage the need for a firebreak lockdown or a short lockdown across the whole of Wales?
I think we had through this period, the preceding documents had said we need a national intervention, and the SAGE document said the same thing. And I think broadly throughout the pandemic, Wales followed SAGE advice.
Could we please have INQ 000385719 displayed, which is an email sent to you by someone at Public Health Wales on the 11th of October. So this is shortly ahead of a scheduled meeting to discuss Welsh strategy and a potential firebreak. The email highlights key areas for discussion at this meeting. Do you agree that there remained, just looking at this email that starts, I've put some high-level points that help us focus the discussion. There remained a lack of clarity in respect of what the strategy for Wales should be at this point of time and who was responsible for identifying that strategy.
Yeah, I think this email's from Giri Shankar, who is a member, he's Director of Health Protection in Public Health Wales and a really excellent member of the Technical Advisory Group. Not being able to remember word for word the policies, but certainly lots of conversation around balancing harm, that every intervention had associated harms and benefits. So whether that was relieving pressure on the NHS, but that would incur economic harm and other associated indirect harms. So I think it would have been very difficult for a minister to stand up and say, these are the absolute levels of harms that we're willing to tolerate, or that we're working to. So I think it was very difficult to be clear on what balanced harms look like.
Can I ask you to have a look, please, in an email of the 15th of October that you sent to the First Minister, Mr Gethin, and Dr Atherton, as well as some others. Yes, thank you. That's the email on the display. You effectively provide a summary of the epidemiological modelling work that had been undertaken to analyse the effect of a firebreak. And in that second paragraph there, we can see you say there are some key conclusions that we would like to share with you. See below. The take-home message is that we act sooner at the end of this week and for longer, 3 weeks rather than 2. We will have a greater impact in terms of weeks gained, with rates of deaths as a measure of success. R will need to be suppressed below 1 to 0.8. Another clear message is the need to find ways to sustainably lower R following any firebreak. So, although your email comes with the caveat that this is a work in progress, is the reason that you're sharing this with the First Minister and the Minister for Health and Social Care because the situation, in your view, called for immediate action?
Yeah.
This is 15th of October.
Absolutely.
Now, the inquiry understands that the Firebreak implementation group was established on the 14th of October. And the purpose of that group was to consider advice regarding potential firebreak in Wales. If we could have a look, please, INQ 000395913. It's an email from you to Reg Kilpatrick on the 18th of October. Subject is COVID Firebreak implementation group. You open by saying that the other side of the firebreak needs to look a lot different to now re-testing and isolation. And then point 5, you say, would very much welcome sight of a detailed economic argument. I think we have been missing this. So do I take it from that your view was that economic considerations had not been factored into decision-making regarding the firebreak up to this point in time?
So can I just go back on the phasing of the firebreak? Is that okay? There was some advice around, and I think it came from Sage, around the timings of firebreaks, that if you got them to coalesce with half-term or school holidays, then you'd lessen the educational impact. And so there was some logic in phasing the Welsh firebreak around autumn half-term. And that was something that we'd considered much earlier in the pandemic around school holiday phasing. But I think the way in which the pandemic was progressing in terms of its doubling time, where small numbers become very large numbers very swiftly, that phasing obviously didn't work as well as it could have. The affordability of turning the economy off was a separate set of conversations that I was aware of, but being presented with the economic argument that those figures weren't as easy to come by as perhaps projections around direct harms.
From a public health perspective, did you consider that there was any other option than to impose a firebreak at this point in time?
No.
There was further advice from TAG produced on firebreak measures on the 18th of October. I don't want to go to that advice other than to just note that TAG recommended a 2 to 3 week hard firebreak to bring R below 1 in order to lessen the impact and slow the growth of the epidemic in Wales. And then a firebreak was announced on the 19th of October. Given everything we've just looked at, the increasing infection rates, the anticipated impact on health services, do you think a firebreak should have been implemented earlier than it was?
I think with the benefit of hindsight, earlier would have been better. It would have got the prevalence lower, but it did what it intended to do and push the epidemic back.
Do you think the firebreak was of sufficient duration?
I think that's a question around. In the modelling, there was some difference between 2 weeks and 3 weeks. There were marginal gains of having 3 weeks, and 4 weeks was better than 3 weeks. So that was from the modelling, but from the actuals, from the observed information post firebreak, it probably worked as well as a 3-week firebreak in that it pushed the pandemic back probably 38 days in Wales and then slowed the next period of growth for the next couple of weeks. In
your one of your witness statements, your TAC and TAG witness statement, you describe the period leading up to and after the firebreak and the subsequent lockdowns in England and Wales as a key moment where there was a significant difference between Wales and England. You then go on to say, England did not follow SAGE's advice to intervene early and also did not support Wales to do so financially. Given the subsequent numbers of infections, hospitalisations and deaths in the autumn-winter 2020 to 21 arising from the circulation of different variants, including the Alpha variant, the policies proved to accrue significant harm in Wales. Can you just explain how the different approach in England accrued significant harm in Wales?
Well, if money had been made available to extend the firebreak, I mean, that's what I've been led to believe, then perhaps we could have had a 3-week firebreak. And certainly from the advice that we were given, it was better to be in lockstep across the UK with clearer public health messaging. That probably would have been better if everybody had followed SAGE advice at that point. But I've not seen the economic argument from the Treasury, say, on not having a firebreak across the UK at that point.
You say in your witness statement that the advice, or your advice, was not reflected in the ministerial advice that was prepared regarding regulations that would come into force after the firebreak period ended on the 9th of November. If we can just have a look at that ministerial advice, please. It's thank you. If we have a look at page 4, paragraph 17, the advice refers to keeping the virus at a manageable level, which it describes at or below RT 1.2. Do you consider, or did you consider, a RT value of or at below 1.2 keeping the virus at a manageable level?
No, and I think Professor Gravner gave a good explanation of what R of 1.2 meant. It still means you're in exponential growth. I think our advice was to keep it at or below 1, which would have been difficult as well.
I mean, why do you think the virus was not held at a sustainable level following the firebreak lockdown?
Because there were too many relaxations and there were more opportunities for mixing of the general population.
TAG published a statement on the 7th of December on MPIs in the pre-Christmas period. We've got that at INQ 000350042. If we can just turn to the bottom of page 2, please. It's the penultimate bullet point on that page. Policy modelling suggests that introducing Tier 3 restrictions prior to the relaxation of restrictions before Christmas will reduce the number of hospital and ICU beds required for COVID-19 patients and deaths. Now, no further restrictions were imposed following this advice. Why do you think the advice of TAG was not acted upon at this time? So this is 2nd of December.
I can't quite remember when the tiers were brought in, but certainly that advice came from SAGE advice around the analysis of the impact of tiers, which from memory, I think 40 out of 43 areas in Tier 3 showed a reduction in transmission and prevalence in those areas. So that was the advice. But as to why Cabinet decided not to, or policy colleagues didn't put that as their policy recommendations, I don't know. I can't quite remember the phasing of post-lockdown restrictions, but I remember there being discussions around alert levels and what would be the sufficient, what would be the right tier to go into.
If we can have a look, please, at some TAG policy modelling advice that was published on the 18th of December 2020. It's INQ 000321023. If we can have a look at the bottom of page 1, advice there states, the most efficient way to reduce harm from COVID-19 and pressure on the NHS is to remove the Christmas relaxation policy and move to alert level 4 restrictions as soon as practically possible, and then high confidence. Now, we know Wales entered level 4 restrictions on the 19th of December. Now, having regard to mounting concerns throughout November and December 2020, do you consider that there was avoidable delay in the Welsh Government's decision-making over moving to alert level 4, effectively a lockdown?
Okay, again, some of these questions are for ministers and policy colleagues, but the advice at the time, based on the modelling, was go earlier, as it was throughout the pandemic. But again, very difficult decisions.
like to ask you some questions now about the winter of 2021 into May 2022. And you've dealt with the advice provided by TAG and TAC during that period in your witness statement, and obviously we will have regard to that. So just a few questions really about the Omicron variant. We know that was identified as a variant of concern on the 27th of November 2021. Ellen Ed Morgan, in her written evidence to the inquiry, has described the decision to reintroduce some restrictions in response to Omicron as an example of a decision that may have been taken differently had more information been available. She said in her statement that at the time there were information gaps in relation to the efficacy of the vaccinations deployed through the vaccination programme against Omicron. Decisions made to reintroduce some restrictions may have been different if that data had been available earlier. Do you agree with that view? Were there gaps in relation to the efficacy of the vaccination programme at that time?
Yeah, I agree. I think whenever a new variant emerged, trying to characterise it in terms of the impact on vaccination status or the case to hospitalisation ratio, the number of people that became infected that would then go on to be hospitalised, there was some degree of uncertainty. I believe from memory, there was a high scenario of a 2.5% case to hospitalisation ratio and a low scenario of 1%. So these were just in the bounds of reasonable scenarios. So there was some uncertainty, and then the new evidence came available, probably from UKHSA at the time, to say that the lower estimate was more likely. So whilst we would have significant number of cases, which we did, which would obviously impact long COVID too, the stress on the NHS would be lower. So then there was a change in advice when the lower estimates became the more likely estimates.
Dr. Orford, thank you. They're all the questions I've got for you, but there are some questions from call participants.
Ms. Heaven.
Thank you, Milady. Just to say that no criticism of Mr. Poole, but he's asked my question, so I've agreed with him to ask the same question, but in a slightly different way, so that you're not surprised looking at the spreadsheet. Good afternoon, Dr. Orford. I represent the Covid-19 bereaved Families for Justice Cymru. Can I just go back to the Firebreak then, please? We obviously understand that that specific request came from you to Michael Gravaner and his team on the 11th of October to model a Firebreak. Now, before I ask you the specific question, if I can just fill you in on some of the evidence Milady's heard. So Michael Gravaner told the inquiry that if there'd been a longer Firebreak, this would have resulted in very low prevalence of the virus into December. He said, in effect, it would have pushed it deep into December. He said a 4-week Firebreak would give a 7 to 9 week suppression time period, which of course would have meant that Wales would have faced a period of high winter transmission plus the emergence of the Alpha variant from a starting point of much lower community prevalence than it in fact had to face in December 2020. And of course that was bringing it much closer to when the vaccine arrived in December. I asked Michael Gravaner if the Welsh Government knew of his modelling results. And this is what he said. So he said the report for the 5 to 7 weeks and then the 3 to 5 weeks was in the report that went in for the 2 to 3 week Firebreak, but it did not include his results for the 4-week Firebreak. But when I asked him about the Welsh Government would have known about the effects of a 4-week Firebreak, so that's the 7 to 9 week suppression time, he essentially said they had all the evidence. It was easy to extrapolate to a 4-week Firebreak. It was a matter of common sense. Now, of course, CTI's asked you a bit about this a moment ago, and you just indicated that you knew that 4 weeks was better than 3 weeks. So can I just check with you then, was it your understanding, and indeed did you know, as a result of Michael Gravaner's modelling, that 4 weeks would push the virus deep into December, 7 to 9 weeks? Was that your understanding?
That was my understanding, and I'm pretty certain that was shared with policy colleagues around that time, and then there were separate requests that came for further modelling.
Okay. So that was going to be my next point, just to be very clear on what the Welsh Government knew. You have been critical in your witness statement about Welsh ministers departing from TAC advice in the easing of the Firebreak. And we've just seen the email that you sent to ministers on the 15th, where you said the take-home is act sooner for longer, 3 weeks rather than 2. TAG then recommends 2 to 3 weeks. So just so that Milady is absolutely clear on your evidence, were Cabinet ministers, and in particular the First Minister for Wales, Mark Drakeford, and Vaughan Gething, told in no uncertain terms that an autumn firebreak for 4 weeks would reduce community transmission deep into December, 7 to 9 weeks, and closer, of course, to the time when the vaccine would arrive? Were they told that in no uncertain terms?
I would have to go back and check on the modelling papers and the internal tax summaries that were shared around that time. However, separate conversations that considered not just the science, like the affordability, for example, would have been had within government. So perhaps those questions are best addressed to policy colleagues who are responsible for developing those policies and advice to ministers.
Just to push you a little bit, though, because we've seen your email to ministers, you see, where it says 2 to 3 weeks. Did you specifically say to ministers, but 4 weeks would push it deep into December? Do you recall?
I'm pretty certain we had advice going through at that time, so I've not got it in front of me, with different policy modelling outputs. So I'd have to go back and check what the papers were at that time. But there was more than one policy model made at that point.
Okay, thank you, Milady. That's my question.
Thank you, Ms. Seven. Yes, Ms. Foobster. You haven't been negotiating, Mr. Poole, about your question,
Thank
have
you,
you?
lady. No, I haven't. Just the one from me. Thank you. Good afternoon, Dr. Alford. I represent John's Campaign and Care Rights UK. And my question's about evidence and decision making. So I'd like to refer you to your individual witness statement, which is the one dated the 19th of December 2023. That's INQ 000390618. Hopefully we can turn to paragraph 190. And 190 is at the bottom of the page, and it goes on to the next page a bit, unfortunately, so hopefully we can see all of it. While we're getting there, I'll tell you what I'm going to be directing your attention to, and that's that at para 190 you refer to a paper for the Executive Committee in April 2020. If we can just zoom into para 190. Thank you very much. So you refer to the paper which is focused on how can we use evidence better to inform effective policies. And then if we can go down the page a bit, it's over onto the second bit of the page to Roman numeral 4, where you note that one of the recommendations of that paper was that the Welsh Government needs to embed a better culture of evidence use within policy development. So my question to you, Dr. Alford, is for your views on what specific changes have been or should be made to ensure that the views and evidence from stakeholders and experts are taken into account by core decision makers.
Thank you. So this work has come from so this was April 2022, from the Strategic Evidence Board. So there's a recognition by the executive group of Welsh Government the need for more evidence to be embedded within policy making, and I think that observation, the Chief Science Advisor Sir Patrick Vallance and Angela McLean currently are doing work to ensure there's greater scientific literacy within the civil service, where there's a relatively small percentage of civil servants that have a degree in science. Broadly, they have degrees in humanities. Some of the work that we've done in the Health and Social Services Group is to develop a division called C, Science Evidence Advice. Within C, there are important functions like SPI functions, which we call science policy interfaces. So people who are able to support policy colleagues, ask evidence-informed questions to support them in developing and evaluating their policies. So there's work like that going on throughout Welsh Government about how we improve our analytical capacity and capability as an organisation. So that work is ongoing.
Thank you very much. Thank you, my lady.
Thank you.
Thank you very much. Thank you very much, Dr. Woodford. That completes the questions we have. I'm not sure whether we're going to have to ask you to come back. I'm sorry, it's the nature of the module
No problem.
system that we've introduced because we have so many issues to investigate. But thank you for your help so far.
Thank you, Leadership.
Mr. Poole.
My lady, I'm in your hands whether before the next witness, we take our 15-minute break now or we hear 15 minutes of evidence.
It's now at 3 o'clock, so what's better for you?
I think probably to allow arrangements to be made if we take it now.
Very well. Back at 3 o'clock.
All rise.
Is anybody else feeling the chill?
Could I
Could we
please...
sort out the temperature, please?
Trying to do it now.
Could I please call Dame Sian Morgan?
I do solemnly, sincerely and truly
I do solemnly, sincerely and truly
declare and affirm
declare and affirm
that the evidence I shall give
that the evidence I shall give
shall be the truth,
shall be the truth,
the whole truth,
the whole truth,
and nothing but the truth.
and nothing but the truth.
Could you please start by giving us your full name?
My name is Sian Elizabeth Morgan.
As you give your evidence this afternoon, if I could ask you to keep your voice up so that we can hear you, but also so that your evidence can be recorded. If I ask you anything you don't understand, please do ask me to rephrase it. Dame Sian, you've provided a witness statement to this module. We have it there on the display. You signed that on the 13th of December last year. Are the contents, what I was going to say, are the contents true to the best of your knowledge and belief? But before I do that, can I just ask you, I think you need to make a couple of corrections if I just walk you through those. If we can, have page 18 of the witness statement up. Let me just see if those have been made already. No, they haven't. Now, I understand that the meetings that you refer to in these paragraphs, so paragraphs 60, 61 and 62, as being hosted by Mark Sedwell, which you refer to as COVID-O meetings, were in fact Cabinet Secretary meetings, not COVID-O meetings, and you did not attend any COVID-O meetings. Is that right?
That's right.
We will make those corrections to those paragraphs 60, 61 and 62. Other than those corrections, are the contents of that statement true to the best of your knowledge and belief?
Yes.
I'm grateful. You were asked to provide a witness statement to this module in your capacity as the former Permanent Secretary of the Welsh Government. In particular, you were asked to outline any role you played in key decisions that were made by the Welsh Government during the pandemic. Before I ask you questions about that, can I just start with a few questions about your career? You joined the civil service in 1977. You were then seconded to the European Commission in Brussels between 1984 and 1987, before returning to the UK, where you were appointed Private Secretary to the Permanent Secretary of the Employment Department within the UK Government in 1990. You were appointed Head of the Employment and Training Strategy Unit at the Government Office for London in 1992. In 1997, you were seconded to the British Embassy in Paris as Labour and Social Affairs Attaché and served as Ambassador to Argentina and Paraguay between 2008 and 2012. And then in 2017, you were appointed as the Welsh Government Permanent Secretary and also appointed Dame Commander of the Order of St Michael and St George. And I think I'm right in saying you retired from the civil service in October 2021. Is all of that accurate?
It's all accurate.
Start with some questions, if I may, then about the structures of the Welsh Government. If we can please have on screen INQ 0000666086. This shows the organisational structure of the Welsh Government as at November 2019, so namely the organisational structure going into the pandemic in January 2020. We can see at the top the First Minister, below him a number of Welsh ministers and deputy ministers, and then we see your former role as Permanent Secretary sitting below those ministers and deputy ministers. Now, we'll come on to the specifics of your role in a moment, but essentially, am I right that the Permanent Secretary is the head of the civil service within the Welsh Government?
That's correct.
And you have the Director Generals, each of those Director Generals that we can see there, the four of them at that stage, each of those are senior civil servants reporting to you. Is that correct?
It is.
Now, Andrew Goodall, in his witness statement to the inquiry, who we'll be also hearing from tomorrow morning, he has said, that despite the range of responsibilities, we, namely the Welsh Government, are a compact administration. All ministers and senior leaders are under one roof and are frequently in the same room together. This enables the organisation to take advantage of being able to work in a highly integrated way and make decisions at pace. Do you agree with that description that he gives of the Welsh Government?
Yes, I do.
Professor Wincott, who we heard from last week, he gave evidence that initially one might get the impression that the decision-making processes in the Welsh Government are overly complex, but he went on to say that having worked through the full body of material that he had been provided with to provide his report, he said a rather more coherent pattern of response from the Welsh Government has come into focus. Do you have any comments on Professor Wincott's evidence in that regard?
Yes, I think that's. I can understand why he made that comment. I think it's fair to say two things. First, that the structures evolved over time and I think became less complex. And second, that in any case, because the Welsh Government is a very small organisation, people knew each other very well and they were often on the different the same person might be on different structures within the Welsh Government, and that meant that people were very well integrated.
So would you say that being a compact administration was an advantage when it came to decision-making during the pandemic?
I think it was.
Turning then to your former role as Permanent Secretary and the role of the civil service in Wales generally, all civil servants in Wales are bound by the Civil Service Code, and as such they're expected to carry out their roles with dedication and commitment to the core values of the civil service, namely integrity, honesty, objectivity and impartiality. Now, you say in your witness statement that for all practical purposes, as Permanent Secretary, you are accountable to the First Minister. Just tell me, what does that mean in practice?
It meant that in practice, I was clear that it was the First Minister who set my priorities for action and in fact who made a very significant contribution to my annual civil service appraisal. My line manager formerly was the Cabinet Secretary, but it was very clear in my contract and in the ways of working that I was very directly accountable to the First Minister for everything I did in that role.
You describe in your witness statement the role of Permanent Secretary as having three main components. Perhaps I just identify those. First, Principal Accounting Officer. So by that you mean managing and accounting the proper expenditure of public money.
That's right.
Second, as we've discussed, leading the Welsh Civil Service. And then third, you were Principal Policy Advisor to the First Minister. Just as regards that third aspect of the role, would it be right to say you had general responsibility for overseeing the quality of advice that was presented to the First Minister and also Welsh ministers, but you were not directly involved in the provision of advice itself?
That is correct.
You go on to say in your witness statement that in practical terms, my responsibility as Permanent Secretary was to ensure that the right people were in the key positions supporting ministers and that they had the right skills, experience and support to discharge those roles effectively. Did you find that at all challenging during the pandemic?
It was challenging in that, again, being a small organisation, there was a relatively small central core, if you like, of people who had the high-level policy skills that that ministers needed in order to prepare actions for the pandemic, to prepare legislation. So we were heavily reliant on a relatively small core of people at the centre.
Would it be right to say that the Welsh Cabinet is the central decision-making body of the Welsh Government?
It would be absolutely right.
And that remained the case, as far as you're concerned, throughout the pandemic?
That's right.
Now, as Permanent Secretary, you attended meetings of the Welsh Cabinet, but you say in your statement you intervened rarely, and when you did, this was in your capacity as Principal Accounting Officer. By that, do you mean your interventions would usually concern sort of staff budgetary issues?
Exactly so.
Although the Cabinet led on collective decisions relating to the Welsh Government's pandemic response, obviously individual ministers were required to make decisions in their own portfolios. That's right, isn't it?
That's right.
I just want to explore with you now some point is about what informed decision-making during the pandemic. I'll start, if I may, with the ministerial advice process. Can you just explain, we've got an example up on the screen very helpfully, this is from the 22nd of March, but can you just explain what a ministerial advice document is?
It is a classic civil service submission, policy submission document. So it will be drafted by the relevant civil servants, and they will identify the key issues. They will set out a range of options, the impact of the different options, and they would give advice to the relevant minister about the range of options.
So if we just look at this by way of an example, not really the substance of it, we can see the top right where it's come from. So it's come in this case from the Public Health Division. We can see who has cleared it, and we can see the date that it's been generated. And then perhaps we can just come out, thank you, to the table there. We can see who needs to make a decision. So for this particular ministerial advice, a decision was needed. Perhaps we can, scroll out, the words in bold. We can see a decision there was needed by the whole Cabinet in this example. And then the table summarises the advice, what's being recommended, and the timing. Obviously, the advice is then set out in the body of the document. And if we could go, please, to page 6, the annex that we see there, this is called clearance tracking. So am I right? This identifies if the ministerial advice raises, as we see there, financial, legal or governance issues. And then there's a statement assuring the quality of advice, and then a copy list of who the advice is going to. That's all roughly accurate?
Totally accurate.
When would a ministerial advice be used?
It would be used on any issue of significance requiring a decision by ministers.
And who in particular would have input? Presumably it depends on the subject matter of the advice, does it?
It does indeed. It would be senior civil service officials who would make sure that they liaised with colleagues in other relevant parts of the organisation to make sure that there was a joined up response across the whole of the government.
And how were decisions made under this ministerial advice process recorded?
They were recorded through a decision report, which was then normally included on the Welsh Government Welsh website.
So these would be externally facing decision reports?
That's right.
Now, the ministerial advice that we've still got, the example we're looking at page 1, I think it says at the bottom, yes, decision report. This decision does not require a decision report. Is that just, again, because of the subject matter of this particular ministerial advice?
Yes.
Because it concerns legislation, is that
Yes.
right? Now, presumably outside this process, and definitely during the pandemic, urgent decisions needed to be made that wouldn't allow time for this process to be followed. Did you have experience of that during the pandemic?
Inevitably. There were 3 core elements to decision-making in the Welsh Government. You've described the first one, which was ministerial advice on individual policy areas. The second process was Cabinet, where Cabinet papers on generally cross-cutting big issues were prepared with input from a wide range of civil servants. And the third was the 21-day review process during the pandemic. And I should add that for each of these processes, there was also a template setting out the requirement to evaluate the equality impact assessment.
We'll be coming to equality impact assessments specifically a bit later on, but just sticking with this process, so ministerial advice, Cabinet, and then 21-day review process. What about where an individual minister needed to take an urgent decision, so sort of outside Cabinet? Presumably that happened during the pandemic.
There were processes for doing that and for making sure that any such decisions were made on the basis of evidence and that they were properly recorded.
And when you say properly recorded, how would a decision being made by an individual minister, say outside Cabinet or outside this ministerial advice process, how would they be recorded generally?
It would be recorded in pretty much the same way as ministerial advice.
The inquiry understands that in April, I think they started on the 6th of April, was the introduction of daily ministerial calls. Did you participate in those calls?
I was present, I think, at all of them, all that I could be present at. They were open to senior officials to attend.
And again, the inquiry's received evidence to the effect that decisions were not usually taken during these calls unless, obviously, the urgency of the situation required it. Does that accord with your recollection?
That's correct. There were times when I think the need for a decision was flagged up in those calls. It was an opportunity to do that, but the decision would then be taken and recorded outside of those ministerial calls, which usually lasted about half an hour a day.
Change of topic slightly and ask you some questions now about the Welsh Government Executive Committee, known as EXCO. Can you help us? When was EXCO established?
It had been operating in a similar format when I first arrived in early 2017. I then, if you like, developed it to do what I felt it needed to do, and it became the core corporate decision-making meeting.
I understand. And I'm right in saying, am I, that you chaired EXCO throughout your time as Permanent Secretary?
I did.
Just briefly describe the role and function of EXCO, please.
EXCO was there to give me assurance that all decisions about corporate issues were taken with all relevant members of the senior Welsh Government team attending and contributing.
And in terms of membership, am I right then that EXCO comprised Director Generals and senior policy officials?
Yes, largely on the corporate side, because one of the things about the staffing of the Welsh Government is, of course, it's not like a Whitehall department, it is a whole of government organisation, and at the time that I was Permanent Secretary, there was no Chief Operating Officer, and those functions came under my group. So therefore, some of those people needed to be represented at EXCO for those kinds of decisions.
The inquiry is aware from Andrew Goodall's witness statement that as well as EXCO, there is something known as the Welsh Government Board. Was that something that was in existence during your tenure as Permanent Secretary?
Very much so. That was a well-established body. It met about every 6 weeks, and it was a body that oversaw governance and general organisational strategy for the Welsh Government. It focused very heavily on governance, risk assessment, and preparations of the annual report for the Welsh Government. It also looked after oversight of delivery of the First Minister's priorities for government. And it would carry out on that basis horizon scans and some policy discussions to look at progress.
I want to next ask you about some changes to the structures that we've been talking about and also changes in personnel that happened during the pandemic. In your witness statement, paragraph 38 of your witness statement, you explain that a committee named Ex-COVID was established in February 2020, which you chaired until your departure from the civil service in October 2021. Is that right?
That's right.
Just briefly tell us, what was the purpose of Ex-COVID?
The purpose of Ex-COVID was to bring together the key senior policy officials and operational officials involved in responding to the pandemic. It followed a format that had been successful in preparations for a no-deal Brexit, and therefore I adopted that. So it was a similar but expanded membership to EXCO, which was the sort of corporate decision-making function. Ex-COVID was not there to take decisions other than in relation to prioritisation of areas of work and reprioritisation of resources within the organisation.
In October 2020, I think you decided that ex-COVID would undertake a lessons learned exercise. Now, we'll return to this in a bit more detail later in your evidence, but just turning to one document at this stage, if I can have INQ 0003-00004, thank you very much. This is the response of the Permanent Secretaries group to that lessons learned exercise. So that's a group that sits under you. On this page, under observations, say, what do you think worked less well? So we're looking bottom right, thank you. And then, for example, for example, ex-COVID was set up with the intention of it being the senior decision-making and resource allocation body under ministers, and I think that its terms of reference still reflect that. But we have found in practice that the pace and breadth of decisions needed made it impossible for ex-COVID to fulfil that role, and instead it acts in a strategic coordination and information sharing role, which works very well, but is not how we envisaged it at the start. So first question, I mean, do you agree with that comment?
Yes, I do.
And did the actual role played by ex-COVID change from its intended role? And if so, why did it change?
I think it evolved very quickly indeed to reflect what the organisation needed. We needed to make sure that everybody was joined up, that information was shared across the organisation, that everybody had access to the same understanding of what was happening. But going back to what I said earlier on, it was very clear that decisions, other than about resources, all policy decisions were for ministers.
Generally, whilst we're looking at one of these lessons learned documents, do you believe that the lessons learned exercises that were undertaken by ex-COVID involved adequate self-reflection on the areas that did require improvement?
I think so. I think we got better at it as time went on, and I found them incredibly valuable. It was an important mirror for us to look at, and of course it gave rise to follow-up action as well.
As of December 2021, I understand that ex-COVID's role and remit were transferred to ExCo. Now, I appreciate you had left post by this time. Are you able to comment as to why it transferred back to ExCo?
I can't comment from any particular knowledge. I imagine Andrew Goodall, my successor, decided that there was at that point some duplication, and the need for ex-COVID, which I think we had all felt was a very valid body, had gone away.
I mean, given that the membership of ex-COVID was, as I understand it, the normal membership of ExCo plus, I think, 5 additional members, why was it felt that ExCo, which was a body already in existence, couldn't simply absorb the work that was undertaken by ex-COVID? Was there a need for there to be 2 bodies?
I believe there was a need for 2 bodies. In the beginning, ex-COVID met, I think, twice a week at the most difficult times, and we did something in ex-COVID that we didn't do in ExCo, which was to have what we call deep dives on subjects, which meant that policy officials across the whole of the Welsh Government were being exposed to, for example, the risks involved in a very wide range of policy areas.
You referred there to deep dives, and I think it's also known as sort of challenge sessions. And in your witness statement, you specifically recall a deep dive into the harms to children and young people. Can you recall what other deep dives were undertaken?
There were a very wide range. We looked at the vaccinations programme, we looked at international comparators, we looked at children and young people, I think, a couple of times. We looked at care homes, the winter planning of the NHS, a very wide variety over time.
I can ask you now about some changes to roles rather than changes to structures. If we can have a look, please, at INQ 000299055. Bottom email, please, on this chain. It's an email from you on the 20th of March to the 4 Director Generals, copies in a number of other officials within the Welsh Government. Yes, top of the page. You say, I'm picking up signals that SPADs and ministers are getting increasingly concerned about a lack of overall coordination on our policy response to coronavirus. Can you explain to me, what did you understand those concerns to be, and when were they first raised with you? This is obviously an email of the 20th of March 2020.
The concern I picked up was that we weren't joining up well enough across the whole of the Welsh Government. That was something that I was trying to rectify with the establishment of ex-COVID, so we intensified that process.
You say in this email Andrew Slade, who was at the time, I think, Director General for Economy, Skills, Natural Resources, could move some of his senior staff to a wider role within Welsh Government. And then 3 paragraphs down, in respect of Tim Render, I think it's suggested that he says there head up a new team responsible for policy, response, coordination and strategic planning. And then goes on in the 4th paragraph, you say the new team would obviously sit alongside Reg's role on ECCW, COBRA, LRFCGs, Amelia's work on shielding and Joe's role as head of preparedness group. But I'm clear we need some serious forward planning alongside the other excellent teams we have in place. Now, at this stage, ex-COVID had been established. I think Reg Kilpatrick was a member of ex-COVID in his capacity as the director with responsibility for civil contingencies and emergency planning. I think I'm right in saying Reg Kilpatrick also led the resilience team, which was operating out of the Emergency Coordination Centre Wales, as is acknowledged in this paragraph we're looking at. Is the new team that's being proposed in this email, is that the COVID project team? Can you recall?
The new team with Tim Render was a small, time-limited team. I knew I'd worked with Tim when I was in Brussels. I knew him well. I knew he had some really good experience when he worked in DEFRA on crisis and emergency planning from dealing with floods. I wanted to bring that expertise into the centre. Going back to what I said early on, I was conscious that we were heavily reliant on quite a small core of staff, and we moved them around as Andrew Slade agreed to do there. We had to be very flexible, very fast acting to make sure that we were moving people with the right skills to the right place.
Was this new team, the intention being that Tim Render would head up, was that new team given a name?
I don't remember the name, I'm afraid.
Could the work of Tim Render, the COVID project team, could that have been absorbed into ex-COVID or the resilience team or any other team in existence? I suppose my question is, did there need to be another team added to already a multiplicity of teams?
EXCO was not a team. EXCO was a committee. The COVID project team was what evolved over time to provide some of the underpinning work. So Tim sat within that for a while before he moved back to his previous role in what was called ESNR, working on rural affairs.
If we could, I think it's in the same chain, but further, I think we're on, yes, further up, page 6. Thank you very much. This is an email from Des Clifford. It's right at the bottom of this page, 2nd paragraph, 3rd line, where he's saying one possible drawback to creating the mooted central policy approach, and I agree that Tim is good at this sort of thing, is that it risks baking in further confusion about accountability lines across the government, i.e. what would go to the central team as opposed to existing directorate structure. Did you appreciate the concerns that were being expressed here by Des Clifford about confusions about accountability lines?
I did, but I felt I knew the skills that Tim could bring, and he, for me, was the right person at the right time to add those skills.
In June 2020, you were involved in the establishment of the Recovery Secretariat. We don't need the email, thank you. That was implemented in, as I said, in June 2020 on your advice to the First Minister. Can you just briefly explain why the Recovery Secretariat was established and what its role was?
The Recovery Secretariat was established to take a forward look. Much of the infrastructure that we've talked about so far was about the immediate response to the pandemic, but it became clear that we needed to do more forward planning, forward thinking on how we would work towards a recovery, and that's what the Recovery Secretariat was there for.
And Simon Brindle was appointed to the role of Director of Recovery. In Reg Kilpatrick's witness statement to the inquiry, he outlines that around this time, so this is June 2020, responsibility for the 21-day review process transferred to Simon Brindle. Does that accord with your recollection?
It does.
And was it right that up until that transfer, it was Reg Kilpatrick that had been responsible for the 21-day review process?
That's right. It came under him until he was promoted to Director General. and then it moved across pretty much at the same time to Simon Brindle.
We can have on screen, please, I think it's another organogram. It's INQ 000066097, but this time we've moved forward to January 2021. We can see that Reg Kilpatrick, along with being Director for Local Government, is now Director General COVID-19. We see his name at the bottom of that group. Now, in your witness statement, you confirm that in September 2020, following discussions between yourself and the 4 Director Generals, and also, obviously, the agreement of the First Minister, Reg Kilpatrick was appointed to this new Director General role. And if we look at this organisational chart as at January 2021, Reg Kilpatrick, as a new Director General, appears obviously still to sit under within Tracy Burke's group as Director General for Education and Public Services. Was the intention that Reg Kilpatrick, as would be a Director General, would lead his own group or sit within one, or is this a distinction without any meaning?
The intention was that he should lead his own group, and he did.
Dame Sian, I'd like to next ask you some questions then about informal methods of communication during the pandemic. In particular, the policies that were in place during your time as Permanent Secretary dealing with the use of informal communications, which obviously include text and WhatsApp. Just like to look at some of those policies with you. First is a document from January 2020. It's INQ 000396686. It's called a CIRO notice, Senior Information Risk Owner notice, and it's entitled Social Media. As we can see from the box at the top of this page, the purpose of the notice is to indicate organisation-wide changes to procedures that must be adopted by all divisions of the Welsh Government. And if we could please go to page 2 of this document, under the heading WhatsApp, says a summary of our position on WhatsApp is that its use does not allow us to comply with our legal responsibilities as a data controller. The full statement explains the position and includes the alternatives for staff in the same way that personal email accounts cannot be used to undertake Welsh Government business. Personal WhatsApp accounts may not be used for Welsh Government business. Now, it is right, isn't it, that the Welsh Government did not allow the use of WhatsApp on Welsh Government devices, so Welsh Government mobile phones.
That's right.
Now, the inquiry does, however, understand that a number of Welsh ministers and officials, including yourself, did have WhatsApp on personal mobiles, and also in the case of Welsh ministers had WhatsApp enabled on their Senedd mobile phones. You were aware of that?
I wasn't aware of that, actually.
So at the time, you weren't aware of the point I made about the use of WhatsApp on Senedd phones?
Not on the Senedd phones, because I had no contact with direct contact with the Senedd structures. But obviously, I was very clear in line with this memo that the Welsh Government phones could not support WhatsApp.
But you were aware, obviously you were using WhatsApp on your own personal mobile. Were you aware that Welsh ministers and Welsh officials were using WhatsApp on their personal mobiles?
I wasn't directly aware, but I would have assumed that they would do.
Now, there's no definition of Welsh Government business, but would you accept that discussing and commenting upon Welsh Government policy on a personal WhatsApp account would fall foul of this notice?
I think what this notice is making clear, and what I'm confident didn't happen, is that no decisions should be taken in relation to Welsh Government business by WhatsApp on private mobiles.
We'll come on to the content of some of the messages in a moment, a bit later in your evidence, but it's right, isn't it, that throughout the pandemic, whilst you were Permanent Secretary, you were in a WhatsApp group with Andrew Goodall, Andrew Slade, Tracy Burke. I think that group is frequently referred to as the Quintet. So that's a reference to the regular meetings established across the Director Generals. So in that group, to take one example, which we'll come back to in a moment, you sent a message asking any questions for my phone call with Chris Wormold at 1400 hours. Would you agree that a question of that nature, although it is not making a decision, but a question of that nature is conducting Welsh Government business?
I would say that it was just a way of getting quick information, much more quickly than by any other route available. It would obviously have come ultimately in an email, so through the proper channels. And after the meeting with Chris Wormold, I would have sent round a short note, not via WhatsApp, but via email, that could be recorded. So for me, that was just a quick heads up that we needed some urgent action rather than any kind of decision or business being conducted.
And
Those who don't know him, Chris Wormold, Permanent Secretary at the Department of Health and Social Care in the UK government. Thank you.
Thank you, my lady. So for you, the key would be, even if there has been a conversation in WhatsApp, it is recording after the event. If it is Welsh Government business, that has to be recorded either by an email or some other form that is then retained.
That is very clear in the guidance.
If we can have a look at a second document, it's INQ 000396685. This is, as it says there, Welsh Government Information Management and Governance Policy, published August 2018 and then last reviewed February 2019. If we have a look at page 2, please, describes the policy. So its policy defines the way Welsh Government information and records should be managed. You're described as the policy owner. We don't need to go to it, but you sign this policy off on page 7. If we can have a look, please, at page 17, paragraph 6.6. It says here, text or instant messages are electronic mail and messaging systems used for the purposes of communication between individuals. Staff should be aware that when using their Welsh Government phones in this way, they are in fact creating public records. Staff using private phones for Welsh Government business may also be creating public records. The ephemeral nature of text messages and instant messaging heightens the need for users to be aware that they may be creating records using this application and to properly manage and preserve record content. So that, as we've just discussed, that's putting in black and white what we've just discussed, namely the importance of retention of records if they're created on, as it says, ephemeral means such as text messages. So this policy was informing those working within the Welsh Government about this need for proper management and preservation. This obviously was a policy that was in place throughout the pandemic. That's right, isn't it? We haven't seen anything. This was in place, although it's dated last reviewed February 2019. It was in place whilst you were Permanent Secretary.
That's right.
The next document, please, INQ 000396694. Now, this is an email sent on the 29th of October 2020. It's copied to you. If we can just have a look at the second paragraph, please. In the last few weeks, my team have received a number of approaches from senior civil service colleagues who are concerned about requests made by senior colleagues to use WhatsApp on their personal mobile phones for work-related activity. As well as breaching our policy on the use of personal devices for Welsh Government business, I'm concerned that colleagues feel pressurised by line managers to breach the policy, left out of work-related discussions if they do not breach the policy. This is a leadership issue and these behaviours must stop. I also understand that records management policies are not being followed as discussions are not copied back to iShare. I remind you that record keeping is part of your responsibility as a civil servant. And then it goes on to talk about our corporate platform is Microsoft Teams, which has a chat feature. Prior to receiving this email, were you aware that Welsh Government officials were not following policies, were not recording discussions back to iShare as they should have been? And perhaps more worryingly, were being pressured into using personal WhatsApp accounts for Welsh Government business?
I was not aware that anybody was under any pressure at all to use personal WhatsApp accounts for Welsh Government business. Had I heard that, then I would have stamped on that immediately, obviously. I had discussed this issue with Peter Kennedy because I was the policy owner myself, so I was aware of his concerns. I should say, in this whole area of informal communications, there were, if you like, sort of 4 safeguards, I think. The messages coming out from Directors General themselves, very clear messages about what was acceptable, what needed to be recorded. There were similar messages going to the senior leadership group, the group of Welsh Government directors that met on a regular basis, and we used that for sort of cascading core messages. That was one of them. We were very conscious that an inquiry would be coming along in due course and that we needed to make sure that all records were preserved. Third point, the circulars, the reminders that you've highlighted here. And then the sort of final control element was something we called the internal control questionnaire, which was completed annually as part of the governance process for assuring the annual report. And each director was required to complete a questionnaire which set out the extent to which they had observed all of these practices properly. That was signed off at Director General level, and there was subsequently a Welsh Government-wide discussion to make sure that we really had challenged the responses. So I think that there were 4 levels, if you like, to give me assurance that the messages were going through, that whilst certain things were acceptable on WhatsApp, any kind of policy discussions or decisions were not acceptable. Nothing like that could take place on private or any other WhatsApp.
With those 4 levels in place, did it surprise you then when you received on the 29th of October 2020 this email notifying you that there were people within the organisation and civil servants feeling pressured to use personal WhatsApps to conduct effectively Welsh Government business?
I don't recall specifically, but I'm sure it would have surprised me.
Can we please look at INQ 000396684? This is the last policy document I want to take you to. It's called Guidance on Private Office Records. It's dated 17th of June 2009. Para 4 on this first page, just talking about really scope of this guidance. The guidance applies to all information which is created in any medium, includes new web-based technologies such as instant messaging, Blackberries and texts. In general, records should be created for all meetings, events which take place with ministers and all officials present when decisions are taken on departmental or government policy. And perhaps if we can go to the next paragraph, paragraph 5. The records of special advisors require separate consideration. Where special advisors have a wide role in the department, have an impact on official business, the records originated by a special advisor should be retained by the department. If the records only mirror those of existing elsewhere, no reason for them to be kept as part of the official records. All papers are concerned with party or parliamentary business should be kept separately and managed by the special advisor. Where electronic systems are involved, it's for the departments to decide how this is best achieved and what controls might be introduced. Now, I referred a moment ago to Welsh Government Ministers' WhatsApp group, which was a chat that was extant during the pandemic. Having looked at the various policies and guidance we've just been through, what is your reaction to the fact that on the 25th of November 2021, Jane Runnacles, who is the head of the Welsh Government's team of special advisors and the special advisor to the First Minister, turned on disappearing messages in that chat?
My reaction is surprise, given that there was very clear guidance to all private offices. I should point out that that I had at that point left the Welsh Government, so I wouldn't have been directly aware of it.
If messages concerning Welsh Government business are not otherwise being retained, as we've agreed they should be, would you agree that it is contrary to the policies on record retention that we've just been going through to have turned on disappearing messages in a chat involving Welsh Government ministers on the 25th of November 2021?
I have to say, personally, I'm not familiar enough with the technology to know what that means in practice, but I think the messages were very clear from the circulars and from all of the instructions that came out to private offices that we needed to maintain proper records, both for the Welsh Government, but also for a future inquiry.
Final document on this topic, INQ 000396461. It's an email sent to all private secretaries to Welsh Government ministers. It's dated the 19th of April 2021. Just reading from the first paragraph, as I mentioned at our Heads of Branch meeting last week, important that we're prepared to respond to any future public inquiry in relation to the coronavirus pandemic, and good record keeping is an essential component of this endeavour. Work is being undertaken across Welsh Government to ensure documents of business value are saved appropriately. With that in mind, I ask that you speak to your Minister to identify any such documents that are currently saved in temporary work areas. If any documents of business value are identified, you will need to ensure they're saved appropriately in iShare. And then skipping to the third paragraph, any and all official business that may have been conducted via text or conducted on non-corporate communication channels, so personal mobile phone, personal private emails, means of communication, should also be summarised and saved to iShare as part of the record of Welsh Government business. Now, that document from April 2021, that's some 7 months before the disappearing messages function is enabled in the Minister's WhatsApp chat. And that's specifically drawing the attention of ministers' offices to the preservation of information for future inquiry. Do you agree that it's plain that even if decisions, which you made this distinction earlier, even if decisions were not being formally taken by informal communication methods, anything of business value, as it says in this email, should be formally summarised, stored in iShare?
Yes.
To you, whilst you were Permanent Secretary, are you aware that that is something that was being undertaken in respect of text and WhatsApp messages?
It was certainly a message that was given very, very regularly because, as I said, we were immensely conscious that we needed to preserve a proper public record for the future.
Change topics next, and I'd like to ask about your involvement in the initial phase of the pandemic, so the period January to March 2020. You say in your witness statement that it is difficult to be precise about when you first became aware of Covid-19 in your official capacity, but that you were on the circulation list of an official internal Welsh Government update on the new virus on the 30th of January 2020. Now, we know the first meeting of ex-Covid took place on the 18th of February 2020. Would this have been the first meeting that you attended in an official capacity regarding Covid, to your recollection?
To the best of my recollection, yes.
Now, by this time, so mid-February, you were presumably aware that this new virus posed a serious threat to public health in Wales. Were you aware of that?
I was aware.
What work had been done by you or perhaps your office prior to this meeting of ex-Covid on the 18th of February to begin to coordinate the response of the Welsh Civil Service to respond to Covid?
I think the first thing to say is that the health professionals led the initial part of the response to Covid, as you would expect, given their expertise. January, I recall, as a period of great uncertainty with growing awareness of the threat. That was a time when the health team were focused on linking up with colleagues in the UK government. I was very conscious that the CMOs, as you may have heard earlier, had a really excellent communication network. So I think during that, during that whole period of January and later February, people were drawing on and strengthening their existing networks to understand what the evidence was telling us, what the data was telling us. My first meeting of ex-Covid, as you said, was 18th of February. It followed on from an important email that Reg Kilpatrick sent a little earlier that month, drawing everybody's attention to the fact this was something we needed to prepare for in a more coordinated way across the whole of the Welsh Government. He had already stood up the ECCW from 5th of February, although it had to expand later. So there was quite a lot of action going on. February, particularly in mid-February, I remember us shifting up a gear and then really continuing with engagement intensifying as we move towards the period of the lockdown.
You say in your witness statement that another standard process adopted by ex-Covid was the implementation of a risk register, which was a document that recorded the extremely broad range of operational risks that the Welsh Government faced as a result of the pandemic. When was the first risk register produced by ex-COVID? Can you recall?
I think it must have been April or May.
And who was responsible for producing that?
I believe it was Liz Lally.
To change topic again and now move on to the coordination and relationship with the UK government. You say in your statement that I and the Permanent Secretaries for Scotland and Northern Ireland also attended regular informal four-way meetings with the Permanent Secretary for the Department of Health and Social Care, Chris Wormold, who established these meetings in order to exchange views on COVID-19 developments and share information. The first of these meetings took place on the 6th of March 2020, and they continued regularly throughout the specified period. Now, as we've already seen throughout the pandemic, there was a WhatsApp group with Andrew Goodall, yourself, Andrew Slade, Tracy Burke. We can just please have that WhatsApp group 000303227. I think we're beginning at the bottom of page 4. So this is on the top of this page, 17th of March. You say, amongst other things, it's so the second entry at the top of that page, 1926. Thanks for an excellent Cov Exco. Saw Jane R, so Jane Runnacles afterwards. She's concerned about new Cobra ministerial structures and lack of DAs. And then Tracy Burke replies at 8:11. Quite a download through Shan, but best we know it. I totally agree with the membership of the Cobra subgroups. We need to be in them at official level or an immediate readout from them how best to raise Tracy. You then reply 8:13. I have a 3 DAs call this morning. I hope and we'll discuss it. I'm also planning to join heads of department by heads of directorates probably by video link, and we'll raise that and the very separate English policy development we're seeing. Tracy then replies, good, vital, we have sight of work of these groups, vital. And then you reply, of course, signs not good so far. And then Andrew Slade replies, this is at 10:04, yes, and I fear Welsh Government describing UK Government's Budget Mark II package as woefully inadequate, even if true, will not have strengthened our negotiating hand. Even the Scots have kept quiet on that topic. So just focusing, if I may, on the comments made about Cobra, what did you understand to be Jane Runnacle's concerns about the new ministerial structures and as she says in her WhatsApp, the lack of DAs?
I think her concern was the same one that the First Minister had expressed for some time, which was the lack of predictability about structures. Cobra meetings happened between about January and May, and they came back again sort of autumn and winter. But they died away in between, during which time there was the ministerial implementation groups, although those two died away. So I think Jane's concerns, reflected what I know were the First Minister's concerns about predictability of communication and engagement structures with the UK government.
You referred in your answer to ministerial implementation groups. Now, the inquiry has heard evidence from Welsh ministers and officials to the effect that although ministerial implementation group meetings took place regularly throughout April and May 2020, they were usually initiated by the UK government, often at short notice, and they say with the agenda being set by the UK government. Does that accord with your recollection and your experience at the time?
It does.
Excuse me. Did you have to take any action to secure the attendance of Welsh ministers and officials at those ministerial implementation group meetings?
There was a joint letter once the ministerial implementation groups started dying away. A joint letter went from me and from my counterparts in the Scottish government and Northern Ireland to complain about the lack of engagement with the devolved administrations and the failure to establish a structure which would enable us to have the kinds of discussions that we needed to.
In your view, would there have been a benefit to using the existing Joint Ministerial Committee rather than these newly created ministerial implementation groups?
No. The JMC is a very kind of formal structure. didn't meet once during the pandemic, which I think is very telling. I believe it has since been revised and strengthened, but it was a very formal and formulaic sort of meeting. I attended a number in my time.
Returning to some WhatsApp messages, then we're looking at INQ 000303227. I'm grateful we're so just to orientate ourselves, 20th of March 2020. You sent a message to the group saying any questions from my phone call with Chris Wormold at 1400. Andrew Slade replies, from my perspective, his take on lockdown and timing. Lots of intel doing the rounds, but I'm not sure as to the quality or provenance. Would be useful to have or gauge his view. And then page 6, Andrew Goodall says, so this is at 1304 is the message. The process feels, so it's second paragraph down, the process feels more and more like announcing a concept and working back ASAP in detail and practicalities that this reflects. The speed of events has meant that some of the spirit of sharing has been disappearing, so we are finding it happening less simply on speed of decision-making and announcements. As we discussed earlier, it feels like creeping divergence, or rather moves to choose who announces first. Don't know how you'd want to raise it, but happening all around, are we ensuring we are learning from what each other's doing? And then Tracy Burke says at 1312, yes, agree to both Andrew's points. Also, if lockdown London, we're likely to see pressures on public services elsewhere as people leave London ahead of lockdown, either to stay with family or second homes, etc. Tracy, to which you replied at 1405, all excellent points, but call now postponed. I can cover them at the 1515 officials meeting instead. Meanwhile, people seem to be running amok on coordination. I still like the idea of a TIM team who could also look at a recovery plan. Deborah could join the TIM team. What do you think? Now, the TIM team, that's the reference to the team you envisaged being headed up by Tim Render that we referred to earlier.
That's right.
In terms of these messages, though, at this time, so this is 20th of March, did you feel there was a lack of coordination between you and your senior officials within the Welsh Government and your counterparts within the UK Government?
I think, to be fair, things were very fast moving, but yes, I did. I think there was quite a variation in the degree of engagement between different parts of Whitehall and the devolved administrations. Those departments, like DEFRA and actually the Department of Health, had a much better understanding of how best to work with devolved administrations, but that was very mixed across the whole of the UK government.
What did you understand by Andrew Goodall's reference in these WhatsApp messages we've just seen to creeping divergence and the spirit of sharing has been disappearing?
I think I took it that he was concerned that from the centre there were anxieties about differences between the devolved administrations and the UK government.
Now, we know, well, certainly the inquiry's heard evidence to the effect that early June 2020, that's when MIGs were replaced by COVID-S, which was the Prime Minister's strategy group, and COVID-O, which was the operations committee chaired by Mr. Gove. The inquiry understands that the devolved administrations and certainly Welsh Government were not invited to attend COVID-S meetings and were only invited to attend COVID-O meetings on a standing basis from October 2020. Is that right? Does that accord with your recollection? I'd like to change topic now and ask some questions, as I said I would earlier, about equality impact assessments. Now, as with any new policy, when making decisions in respect of MPIs during the pandemic, you would accept that there was a general duty, obviously on the Welsh Government, to consider vulnerable groups and those with protected characteristics. Yes?
Yes.
The inquiry understands that no equality impact assessments were carried out for the initial 21-day review of the coronavirus regulations, nor in fact the next 3 reviews. So there were no equality impact assessments carried out in respect of the restrictions for nearly 3 months after the initial lockdown. That's right, isn't it?
My understanding is that there was a great deal of work going on, that there weren't, that the team were under such pressure and ministers under such pressure that it wasn't always possible to prepare a formal equality impact assessment. But nonetheless, I should emphasise that all three of the decision-making processes that the Welsh Government used involved a detailed template which took the drafters through the process of an equalities impact assessment. We called it an integrated impact assessment because it covered a very wide range. So ministerial advice, as I've said already, plus cabinet papers, plus the 21-day cycle, each had their own template for assessing the equalities impact of any policy or restriction or lifting of restrictions that was being considered. So I think that whilst there were times when there were no formal impact assessments published, there was always a great deal of thought given to the impact of different restrictions on different communities within the Welsh Government. And not just because there was a template setting it out, but also because I think all of us were very clear that it mattered a great deal to Welsh Government ministers, in particular the First Minister, that we should address all aspects of inequality in everything that we did.
No, obviously, I can understand that the initial regulations were drafted under exceptional circumstances over a very short space of time. But in respect of the next 3 21-day reviews, so obviously doing the maths, that's nearly 2 months. Do you accept that full impact assessments could and should have been undertaken for those subsequent 21-day reviews?
I do. I received during that period a number of letters from the Reverend Coombs, from the head of the EHRC in Wales, and we had a number of very worthwhile and positive discussions together. I had to explain that in the early days it was very difficult to publish equality impact assessments because the resource available within the Welsh Government for translating those impact assessments into Welsh was very thin, and obviously it was a period when we had to prioritise translation of the legislation. And I should say that, as you might expect, it was not legal for us as a government to publish anything in English only. We had to publish the English and the Welsh versions together. So that was an issue. I do think that Dr. Coombs, I got the impression that she was reassured by the information we gave her about the work that was actually going on, and that was extremely important, and the commitment that ministers were making in their decision-making process to the effect of all legislation on different communities within Wales.
The inquiry has got, and I think you in fact refer in your witness statement to the correspondence you've mentioned with the Reverend Coombs. So there were letters back and forth in July 2020, early 2021, culminating in a response from you on the 10th of March 2021. Would you say that the process for publishing EIAs improved after March 2021, after you'd had that exchange with the Reverend Coombs?
I believe it did, although I'm conscious that I had to reply to one of her letters that we'd actually published the impact assessments in the wrong part of the Welsh Government website.
Now, in Wales, there's a duty under the Rights of the Children and Young Persons Wales Measure 2011, also the Children's Rights Scheme 2021, a duty on the Welsh Government to have regard to the United Nations Convention on the Rights of the Child in exercising its functions, which in turn requires considerations of the best interests of the child. And the Children's Rights Scheme also requires the Welsh Government to undertake a children's rights impact assessment as part of an integrated assessment. Can you help us? Were children's rights impact assessments undertaken by the Welsh Government?
They were, and the Welsh Government website does contain those that were carried out. Just as an example, because I checked this, obviously, in February 2020, there was a children's rights impact assessment on alert levels and restrictions in Wales. November the same year, there was one on adoption and fostering regulations. The following year, there was a children's rights impact assessment on moving to remote working. They were carried out regularly as separate significant impact assessments on their own, as well as the impact on children and young people being considered in the integrated impact assessments that we've been talking about earlier.
If I can change topic, please, and ask some questions about your engagement during the pandemic with the Welsh Local Government Association. On the 21st of March 2020, Chris Llewellyn, who's the Chief Executive of the WLGA, emailed you and the Directors General requesting early engagement with the Welsh Government. Were structures and processes put in place to ensure early and effective engagement with local government?
There were already very good networks between officials who needed, for policy and operational reasons, to work closely with local governments. So, for example, Reg Kilpatrick had excellent relations with his colleagues in local government in a variety of areas. The same with Tracy Burke, who was the DG responsible for education. For obvious reasons, she needed those. What we did as a result of invitations from the head of the WLGA, Chris Llewellyn, was set up meetings with him and with the 22, the chief execs of the 22 Welsh local authorities in order to exchange views and ideas and concerns. I would say, honestly, that I could have done more. I think it would probably have been a very good idea had I invited the chief exec of the WLGA to become a member of ex-COVID, or at least come from time to time when there was an area of particular interest. I think I could have done more to establish that level of regular contact. And in retrospect, I think I should have established myself a pattern of regular one-to-ones with both the CEO of WLGA and of SOLIS, the Society of Local Authority Chief Executives.
Dame Sian, they're all questions I've got for you, but I understand there are some questions from core participants.
Yes, Ms. Heaven.
Thank you, my lady. Good afternoon, Dame Sian. I represent the Covid-19 bereaved Families for Justice. First topic, please, is again the issue of WhatsApp and deletion of message chats by members of the Welsh Government. Just so that you fully understand the context of my question, obviously we've had disclosure of extensive WhatsApps, and we can see that WhatsApp's being used for a range of issues by special advisors and ministers touching on Welsh Government business, work-related activity from, for example, pre-announcing policy to officials, asking for clarification on government policy, policy discussions, seeking assistance on what officials and ministers should do in certain circumstances. This is just a short list, but you get the idea. So you've been asked about the disappearing messages being turned on by Jane Runnacles. I just want to give you another example. There are quite a few, but I'll just give you another one. To be clear, you're not in this WhatsApp chat, okay? This is a WhatsApp chat called Drake Spads. And it's the 24th of September 2020, and we don't need to name the SPAD, but there is a special advisor who says as follows: just realised I've deleted the chat on this group for a very long time, will do now, and recommend others to do so. And then he says, noting I seems to mean I have not. Okay. So as I said, there are others. I'm just giving you one example. So you're obviously surprised about the Jane Runnacles turning on deleting messages. But do you agree that if other SPADs, our special advisors, are deleting messages and encouraging others to do the same. There was obviously an issue on retention of WhatsApps that went much wider than Jane Runnacle's. Is that a fair comment, do you think?
I think all I can say is that there was a very clear message that had gone to Private Office about what the proper procedures were. I am not aware personally of the messages that you're referring to. I did read some of the WhatsApp chain that came through, but it was very long. Something that struck me that I was certainly reassured by was that where ministers were asking for clarification of particular policy areas or decisions, then the SPADs, and I think it was from recollection usually Jane Runnacle's, said that they would send an email to set that out. So I was reassured by that kind of response, but I can't really comment on the deletion of messages beyond saying that it was very clear from the circulars had been sent to Private Office that was not appropriate, that was not right.
No. So special advisors are deleting messages and encouraging others to do the same. You'd agree that was clearly wrong, shouldn't have happened.
That was not in line with our policy.
Did you ever turn on disappearing messages or delete WhatsApps?
I didn't turn on disappearing messages, and as I said earlier, to be honest, I wouldn't know how to. But I know I deleted a few early messages. I have no recollection of why, beyond, I suppose, just an attempt at housekeeping. But I am very glad that the entire conversation has been made available to the inquiry, because others, and I think notably Andrew Goodall, kept all his WhatsApp messages very properly.
Okay, thank you. I'm going to move on from WhatsApps now to separate topic of face coverings. And just so that we can situate it, this is the 9th of June 2020. And as we know, on that date, Vaughan Gething gave a press statement announcing the latest position that the Welsh Government was taking on face coverings. And, I mean, he said a lot in that press conference, but the gist of it was that the Welsh Government was recommending face coverings on social transport, in public transport, where social distancing was not possible. And, of course, we know by this time the UK Government had announced that on public transport, face coverings were mandatory. So at this point on the 9th of June, we have this divergent approach on public transport, Wales versus England. And so I want to ask you about a WhatsApp exchange where you appear to be discussing this policy announcement. So if we can get up, please, INQ 30 388 424, and it's 004, please. And the entry is right at the bottom. Now, I appreciate that it's tricky to remember hundreds of WhatsApps. So let me just take you to it. It's at the very bottom here. And it starts off with, on the 9th of June at 10:32, you say, hope all goes well at the press conference. It all sounded a bit muddled at 9 a.m. And then we have somebody whose name's been redacted saying, a number of heads banged together and have thrown as narrow a ring round it as I possibly can to avoid all the knock-ons. Still pretty worried. Transport colleagues in the loop from the TFW side. And then you respond again, good, huge scope for multiple misinterpretation and face mask militancy. Okay, so first of all, do you remember this exchange or
not in detail, I'm afraid.
Okay, well, let me see if I can assist you. So first thing is, you're talking about something having gone wrong. What had gone wrong? What was the concern around this announcement that had to be made on the 9th of June, which, as we know, was clearly diverging from UK government policy?
I don't know what had gone wrong.
Okay, fine. Moving on then, you were talking here about face mask militancy, so that's your phrase. And just to see if you can assist us with what you meant by that, see if I can assist you. Do you mean that there may be a risk that certain people would have a go at other people for not wearing a mask?
Yes.
Okay. So just to understand then why this was a concern for you in the context of this policy announcement, was it being anticipated that the Welsh Government divergence approach on face coverings, particularly on public transport, could result in people having a go at other people? Say, for example, an English person coming on the London train to Wales wearing a mask might then have a go when they got into Wales because somebody didn't have a mask on. Was that what you were concerned about, do you think?
I think that would always have been a possibility, but I also think that there was very clear advice given to people about what the rules were in Wales and what the rules were in England.
But why, just on this face mask militancy, why are you concerned that there may be face mask militancy? Why was this even
I was concerned
for
about
you?
people being angry.
Okay. Why?
Because there was such a lot of emotion at the time around the pandemic, not surprisingly, and I was concerned about any anger amongst people.
Does this maybe suggest that there was a degree of hesitancy, certainly within certain quarters of the Welsh Government, about mandating and requiring Welsh people to wear face coverings in public? That there was a hesitancy?
I didn't detect any hesitancy. I think you've heard earlier today from Sir Frank, who will have explained to you the advice he gave to the Welsh Government at different times. So I would not say there was any hesitancy. I think the Welsh Government and ministers at all times were very clear about the decisions they had taken. So no, not hesitancy.
What expert evidence did you have to suggest that this concept of face mask militancy was something that had to be considered or given any credence at all? Did you have any expert advice?
I had no expert advice. I wouldn't describe that comment there as a comment of significance beyond general concern about people's reactions to each other when they were under the horrendous pressure of the pandemic.
Thank you very much. Thank you, my lady. Those are my questions.
Thank you, Ms Heaven. I understand that we've had some extra questions come in. Mr Gardner, do you have a question? We're running out of stenographer time, so just to make sure everybody understands, I will cut people short when we get to the stage where we're running out of time, overrunning out of time. So, Mr Gardner, was there a question you wanted to put?
I'll anticipate no more than 3 or 4 minutes. Just a line of inquiry in relation to careers, effectively.
Actually, have I got the right? Yeah, very well. Ask your question, Mr Gardner.
Jane Morgan, I just want to pick up on where we were in your questions, in your answer to the Council inquiry relating to children's rights impact assessments. Would you agree with me that for careers to be effective, I apologise, I am not turned on the microphone. Would you agree with me that for careers to be effective, they should be contemporaneous documents?
Sorry, for what to be effective?
Them to be effective documents, they should be completed contemporaneously.
Ideally, I would agree with that, but there are, of course, circumstances where it's not absolutely possible to do that if there are competing priorities.
And how would they go about considering the impact of policies and decisions if they're not completed contemporaneously?
They would draw on contemporaneous evidence. I think that is the point, and that takes us back to the need to record all evidence and how decisions were taken.
But how would they be in the mind of the decision maker if they're not being completed alongside the decision?
I think in most cases they were. It depends whether you're talking about the integrated impact assessment that was carried out at the time of the ministerial advice paper or at the time of the discussion on the 21-day review. If you're talking about the separate impact assessments on children and human rights, those were significant documents which inevitably had to draw on a range of information.
So, in effect, would I be correct to say, as Sally Holland said in her evidence, that certainly in the early stages of the pandemic, children's rights impact assessments were not being habitually undertaken at the time of the decision to which they relate?
I think it depends what you mean, because I am confident that none of our ministers would have taken any decisions that had an impact on children and young people without having considered those factors.
I'll come back to that, I think, in the general point, but...
I'm not sure you will, Mr Gardner. I'm afraid we're going to have to cut you short there. I'm sorry.
There, my lady, or just one?
There.
I'm grateful.
Right. I'm sorry, Ms. Weaver. I thought you were looking at me quizzically. I'd completely forgotten I'd given permission for you to ask one. You wanted to ask permission to ask a second one, is that right?
I think we have 2 pre-approved ones, and it was a further one, but I can, if we have time, I'll ask permission,
Thank
but
you.
I'll start with the other ones. Thank you, my lady. Good afternoon, Dame Sian. I represent John's campaign in Care Rights UK. I'm going to refer to your witness statement, which is INQ 000371233, on page 10, paragraph 33. And you say at the beginning of this paragraph that you believe that the Welsh Government had a strong focus on vulnerable and at-risk groups, and you cite initiatives such as the BAME advisory group. Do you believe that the government had the care sector in mind?
I do believe that.
Are there any examples of comparable initiatives in relation to carers or people who require care?
I'm afraid, not having had notice of the question, I can't give an example that springs to mind, but I know that the Welsh Government ministers were looking at all vulnerable groups and looking at whatever they could do to manage the pandemic across the whole country. I can't at the moment think of a specific example. I'm sure there will be an opportunity to do that in later parts of the inquiry.
And you explained deep dives to us earlier this afternoon, and you mentioned specifically a deep dive on care homes. Do you recall what that covered, and would it have covered, for example, consideration of the indirect harms of the COVID response on people in care homes?
I think I referred to a deep dive on social care, and I don't recollect the detail of that discussion, but the whole point of the deep dives was to look very broadly at the immediate and the longer term impacts of any restrictions, any policy developments. So I am quite sure that we would have covered that.
And so just to be clear, because I think earlier you referred to care homes and just then you said social care, would it have covered things like unpaid care, domiciliary care, rather than just being limited to care homes?
I don't recall, I'm afraid, in sufficient detail to be able to say confidently.
My lady, that leads me to the one we don't have permission for yet, if there's time for me to request it.
It's about whether, well, you can ask the first one, which is the health professionals led the initial part of the COVID response.
Yes, so Dame Sian, earlier you explained that health professionals led the initial part of the COVID response. Does it follow that you considered their involvement became less pronounced as the pandemic progressed? And if so, do you think that was right, or do you think they should have remained at the forefront of the response?
Not at all. I think the rest of us joined in. It's that way around, that we went from a response by the Welsh Government that was led by the excellent health professionals to a Welsh Government-wide response. At the beginning, it was the Health Minister who led in discussions and negotiations with the UK Government, for example. But as time moved on and it was clear that what the potential impact of the pandemic might be across Wales, then the whole of the Welsh Government took part in those discussions. So rather than the health professionals being put on one side, we were heavily dependent on them throughout the whole process. And as I said, I think Andrew Goodall led that process really outstandingly.
Thank you, my lady.
Thank you very much indeed. Thank you very much for your help, Dame Sian. Tempted to ask you what it's like going from the diplomatic service to running the civil service in Wales, but I think maybe for another time. Thank you very much for all you've helped done. Right, that completes today's evidence.
My lady, it does.
And we shall return at 10 o'clock tomorrow.
All rise.